Bleeding in real life can be scary, and most people panic when they face. After the session of today, you should not be panicking because you will have the necessity tools and skills and the basic elements how to handle the situation at the spot. My name is Saman. I'm a registered nurse with a decade of experience in ICU and emergency department. I'm a health coach and certified by American Board of Regenerative Medicine. The topic for today is bleeding. Bleeding might happen anytime, anywhere due to so many causes. It can be accident, fall, kids playing outdoors, biking, hiking, even when you do your households, and it might happen any parts of your body. When you face a bleeding, it might look scary, which indeed it is, but if you do not act promptly and focused, then consequences would be severe. Not even the person who is suffering is in trouble. You have to try to hold your confidence and just think and be present at the moment. How can you secure and save the patient or the person until help arrives? Here at Joint Space, we have established this community, a team of different specialists and professionals sharing our skills and knowledge with our audiences, clients, and patients in order to support each other and our audiences during this period. And these skills are lifelong skills, not necessarily because of due to current situation. Feel free to join us in our WhatsApp community group, which is linked in bio, and we will get started. We have three different types of bleeding: minor, moderate, and severe. Minor bleeding represents small cuts any place in the body, and this small cut can go with droplets of blood, or it can be a minor bleeding which can be handled with a simple pressure. Moderate bleeding comes with deeper lacerations or cuts, and the blood flow is a bit steady. There is blood flow, it's not severe, it's not spurting out, and it's not leaking. So we have a steady flow, and it is manageable with a firm pressure. The third type is severe bleeding. When the blood is spurting, pooling out, you can either visibly see the blood is flushing out, or if the area, the leaking, the bleeding area is covered, you can notice that that area is pooling because of a fast pace of blood flow. These three emergencies might happen, and we have multiple universal rules. We have some do's and don'ts for any type of bleeding. What are don'ts? Firstly, if we have a penetrating object in the body, we don't remove it. We don't take it out. For instance, there is a knife in the arm, there is a piece of glass, debris of metal, or whatever that has penetrated into the body, we do not take it out. Why? Because that fragment already works as a barrier. By taking that object out of the body, you facilitate more bleeding. So we don't take it out. What to do, we will discuss shortly. 2, we do not use home remedies, meaning toothpaste, coffee, powders, because even though the bleeding itself is severe complication, but the second most important thing is infection. So we are not going to use home remedies. We will just apply direct pressure. Another don't that we shouldn't be doing is aggressively cleaning the area. For instance, if there is an accident or if there is a fall, and we can see there is open wound and it's dirty, we are not going to scrub it. The ideal thing, if we want to do, if it is provided available, is to keep it under running water. That's it. And obviously the most important, to call emergency services immediately. So what do's we have to do is, our first step is always direct pressure. So applying direct pressure on the affected area. Another do is, if it is available, using gloves. If not, then we cannot do anything. We have to just aim at stopping the blood flow. Another do would be making the patient steady and still, no further movement. So these do's and don'ts goes for any type of bleeding. At the same time, you have to assess the situation, meaning if the area is safe for you as a rescuer. So you will check the area for safety, of your own safety first, and then safety of the client, the person who is suffering, and then our immediate interventions. Then we will have different parts and different fragments, how to deal. I will invite my colleague to join me in order to present how can we deal. We have different categories of bleeding. One of them is just a cut, meaning we have the affected area, there is a cut, there is bleeding, but there is no object inside. So for that type of bleeding, our first step is direct pressure on the area. Based on the amount, the length of the cut and how bleeding it is, we have to use some appliance or tools in order to prevent. Talking about bleeding, so last session we were talking about fractures. In fractures, we need some rigid items to keep the limb still. But in bleeding, we need high absorbency. So we have to use some items that can absorb and at the same time, they do not dissolve. For instance, for bleeding, if you put tissue, no matter how many, they will dissolve in the blood. So what can you use as alternative? Items that we all have at home, sanitary napkins, or kids' diapers, both not available, a hand towel, or a clean t-shirt. Because absorbency is the key to help prevent further bleeding and make clot. For instance, if we have a laceration here, the towel, t-shirt, or whatever that it is, will directly go on the laceration. And then we will hold it stiff and with a long time period. One of the most important keys here is do not check repetitively, because by removing the clot, you interrupt the process of clotting. So when you cover it and you hold it steady, just keep it as it is. Because let's say you want to check what is inside. What are you going to do? Right? So better to just keep as it is and help with blood and clotting. If the blood is active and severe and we have pooling, let's say this towel is now full blood, we are not going to remove it. We will keep it as it is. We will put one more on top. Second one is pooling. We will put the third one on top. So we will not remove the underlying tools. We will just keep adding on and we will continue direct pressure until help arrives or until bleeding stops. And if we are alone, if the bleeding has stopped and we are able to move the client, what items can we use in order to wrap it? It can be a shoelace, it can be a belt, it can be even an exercising band. A shoelace in order to wrap it tight. But this is in a case that we have held this position long enough. Or it can be the same idea. It can be a belt, or it can be these exercise wraps. The whole idea is to keep it steady as a bandage. The other type would be bleeding due to penetrating object. It can be a knife, it can be glass, it can be metal, whatever that has penetrated your body. In such a case, so we said we are not going to take the object out. We will keep it as it is, but we have to make sure this object is not going to move left and right. So we have to secure this object in order to prevent further movement and control bleeding, because the more it moves, there is a possibility that it causes further damage under. So if we assume this knife has penetrated the arm, we're gonna wrap the same knife or the object as it is using a rolled shirt. Here, as you see, this rolled shirt can help with prevention not to move the knife or the object, and at the same time by squeezing both sides of the penetrated area in order to stop the bleeding. And also we can use wrapping the same with a shoelace or with a sport bandage. In such a case, a belt is not ideal because a belt cannot provide equal pressure around the area. So the ideal is to make sure the object is not going to move, and then we will have enough coverage and support around the penetrated area. Another type of laceration that might happen is a long laceration, a big cut that a large amount of the tissue or the body has been affected. In such a case, our priority is to stop the bleeding. For this matter, we need a larger absorbent. It can be a big towel, it can be even a blanket. And how to do it? A clean towel to be used and to be wrapped around the area. And if it gets soaked with the blood, we will add one more. No towel, shirt. But make sure, please, that you use clean items because, as I mentioned, infection is the second most important thing that we have to be cautious about it. Another type of bleeding that might happen due to accidents or falls is a skin tear. What do I mean? For instance, a cut might come vertically or horizontally and remove the tissue and the muscle or underlying structure. So in such a case, for instance, if we assume this is part of the tissue and there is a cut over here, there is a tear over here, we will just gently put it back. The skin itself, the tissue itself, it works as the best barrier. So we are not going to remove it, even if it's just a layer of skin. Even if there is a blister, we are not going to puncture the blister itself. We are going to evacuate. We will just use it as the main cover. And on top of the skin itself, we will put padding. We will put tissue and we will hold it tight and steady. No movement. When we talk about blood, we consider our heart as the engine that distributes blood all around our body. The farther you get, the less bleeding you will have. For instance, in the hands and feet, we have less bleeding. In the forearm and calves, we have a bit more bleeding compared to feet and hands. So the closer you get to the heart, the chance of bleeding is high because we have major arteries and veins. For instance, in our arms, under our collarbone, there is two big arteries and veins passing almost our biceps, our upper arm. The same applies to our legs. We have big veins and vessels that are passing by our groin. So the higher we get, the closer we get to the heart, the risk and the chance of severe bleeding is more. So when we manage to wrap the area, ideally, if it is available at home, we can use pillows to elevate the arm. Why? Because we want to keep that affected area higher than the level of the heart so that we have less blood flow. If the patient has suffered from legs, we will make the person flat, and we will put multiple pillows under their leg, or if there is available sofa, stones, wheel, whatever that you can just think of it, how to elevate. For legs, client will be flat. For upper body, they can sit or they can semi-sit in a recliner, and the affected arm will be elevated. And there are some common sense and common symptoms that you can pay attention if the situation gets worse. With bleeding, we might have pale skin. You can see that the person is getting white or yellow because the blood pressure drops. They might feel cold, again, because blood is warm and there is no circulation in the body. Another one is fainting. Due to blood loss, the person might even faint. So these symptoms indicate that the situation gets worse. So before you get there, you have to be already taken those necessary steps. Calling emergency, wrapping the area, stabilizing the patient, and preventing further blood loss. We'll start with the head. So if the bleeding comes from the neck, from the head, usually it's severe because we have lots of blood supply. Then the first step, as we said, will be direct pressure to stop bleeding. But there is two important points that you need to pay attention. If there is a bump, it's called hematoma. If there is a bump, you shouldn't be squeezing too much because that simply indicates there is internal bleeding. With squeezing extra too much, you might explode that hematoma, that bump, and you might cause internal hemorrhage, internal bleeding. Second thing that you need to pay attention is a depression or a curve. For instance, if there has been a big trauma to the head, and there is kind of dent or curvy shape on the skull, you might suspect that the skull, the bone itself, has been affected. So by pressing too much, you might push those debris, bone spores, into the brain itself. So talking about the head, if there is bleeding, the only intervention is to hold with a clean napkin, tissue towel, and keep it firm. But if there is a dent or if there is hematoma, we shouldn't be pressing too much. Another type of intervention comes from elbows or knees. Why this is important? Because when you stop bleeding due to movement, again, it might start bleeding. So in such a case, we have to stabilize the joint itself. So when we consider the elbow itself and the bleeding happens around this area, we slightly bend so that it's comfortable for the person and the person can stay steady. And then to support the area by filling the gap. How do we fill the gap? Roll towel and compressing the area. By this case, the arm stays steady and still without movement. And if there is a fracture, for fracture techniques, you can watch the previous video. For fracture, in case there is fracture and bleeding, then we have to use also arm splint, using a spatula, using magazine, to absolutely make it still, no movement. And for the knees, I will show you how will it look like. So for the knees, as you see, when we lie down, there is already empty space under the knee. So this might be uncomfortable when you want to apply a steady pressure for a long time. And for the person who's supposed to stay steady for a longer time. So in such a case, you can use a pillow or something large to support the knee so that it is manageable for the person itself to handle the situation. One of the key points that I mentioned, that we have large vessels and arteries going through the knee. If the bleeding comes from the knee, you need a direct pressure with straight arms, meaning you might need, if the person is on a higher altitude, you might need a seat or chair, or if the person is on the ground, you have to make your arms straight and use your body weight to control the bleeding, because this area comes with severe bleeding and it comes with pooling. So we will have absolutely straight pressure using your body weight, not even your arms, to control the bleeding. Another complication that usually happens with the legs, if you are hiking, if you fall down, if there's accident, usually deeper cuts happen with thighs. When a deep cut happens and you lose the tissue, right, you have to do padding. What does it mean? For instance, if here there is a gap, you have lost the tissue, the wound is open and unmanageable, you will put the tissue in the tissue. You will put the cling cloth, towel, whatever that it is, inside the body, as if you are trying to fill the gap. So even though you are going to fill the gap, you might face severe bleeding and pooling. You are not going to take this from the body. This will remain inside the body, and then on top of it, you will have more tissues to control the bleeding. Another part of bleeding might happen on your abdomen or sides. For this area, bleeding is really vital because you might have internal bleeding or you might have external bleeding. Considering the abdomen area, if there is penetrated object, we are not going to take it out. Second, if there is no object and it's just bleeding, we will hold the pressure. The key point, the key difference is with the abdomen, we cannot apply our body weight because we have organs underneath. By applying further pressure, you might damage or hurt underlying organs. But for abdomen area, we can use the total muscle mass, the force of our own hands to try and hold the bleeding. And again, if the blood is pooling, we are not gonna throw this one, we will add on top in order to handle the bleeding. Then we have bleeding from back. This part, which we have our spines and we have mainly bone mass here, mainly we are concerned about fractures rather than bleeding. But if the bleeding happens, again, we have to consider the nervous system, not to damage the spine itself. And again, our first step is to manage the bleeding. And second thing, we can ask the client if they are capable of moving their fingers, their foot. This simple assessment indicates that their nervous system is fine and their spine is intact. And then we can continuously keep the pressure to prevent bleeding. If there is object at all, we shouldn't be removing because we don't know if the nerve has been damaged or involved. This would be our basic steps dealing with any type of bleeding. So what you can use, it has to be highly absorbent, like sanitary pad, like diapers, shirt. And what you can use for wrapping can be a t-shirt, scarf, shoelace. Belts are not very much recommended. Why? Because with the belt, we cannot provide equal pressure on the affected area because eventually it has a limit. You cannot tie more than what it is. And also, for instance, if the bleeding comes from here and the vein is passing by through your biceps, right? The belt cannot directly push on the spot. So the belt is used mainly for fixing in fractures or bleeding, but it's not used to stop the bleeding. Our first step, our first intervention is direct pressure. If the situation gets worse, this is only exception, and our last option is using a tourniquet or a scarf to completely stop the bleeding. This is our last step if the situation gets worse, if we face those symptoms of patient is getting pale, losing blood pressure, losing their consciousness, feeling cold and shivering, fainting, and you can see that whatever you do, you cannot stop the bleeding with multiple layers of tissue, with elevation, the blood doesn't stop. Then this is our last option. With a scarf or with a tourniquet, you will fasten almost 2 to 3 inches above the affected area. So if the blood comes from the forearm, you will fasten above the elbow. If the blood comes from the arm, you will literally move to the underarm. The same applies to the leg, 2 to 3 inches above the affected area. If, as your last option, you need to use a tourniquet to completely disrupt the blood flow, make sure you write the time with a pen, even with the blood itself. Write it somewhere, the patient's body, piece of tissue, wall, wherever that it is, because the timing matters the most for emergency team to understand what are the further steps they need to take. Because in such a case, you are disrupting the blood. If you fasten the tourniquet or a belt or a scarf, do not loosen it at all, not even for a second. Because there is an ideology that every 5 minutes we can loosen for 5 to 10 seconds to have blood flow at all. You will fasten the tourniquet and you will keep it as it is. You will mention that you will write the timing and you will be waiting for the help. That shows the importance of calling the emergency services immediately. So again, I would like to review do's and don'ts. What are we going to do? We will call emergency. We will elevate the affected area. We will use direct pressure, and we will use gloves if available. What we don't do, we are not gonna take out the penetrating object. We are not going to use home remedies like toothpaste, like coffee, like powders. We are not gonna use tissue, regular tissue, because it will get dissolved in the blood itself. So the steps are simple, the action is simple. You shouldn't be panicking. You have to take vital decisions in order to control the bleeding. It looks scary, yes. It is painful for the person, yes. But all you have to do is to help how to survive, how to revive the client. If you have any further questions regarding fractures, last session, regarding bleeding this session, please comment. We will have another session next week, which will be about airway management. Please join us in our WhatsApp community. And if you need further support, any questions, do not hesitate to message us. Stay safe, take care.